That's a very good question, is that how did it end up that myself and Caring Medical, we end up treating a lot of people with pelvic floor dysfunction and pubic pain and groin pain? Well, early on when I would see folks basically, believe it or not, with chronic low back pain, and it was clear that they had a sacroiliac problem, but that sacroiliac problem wasn't responding typically normally with prolotherapy. In other words, I would treat the sacroiliac joints with prolotherapy and the person would get better for a while, and then it seemed like the subluxation or the instability would come back. Well, the front of the sacroiliac joint, or the front of the pelvis, if you think about it, is the pubic symphysis. So in other words, the pelvic bones, the iliac crest, the pubis, the back part of the joint, or the posterior part of the joint, is the sacroiliac joint, and the front of the joint is the pubic symphysis. So I surmise that maybe the person has weakness in the pubic symphysis. That's why the sacroiliac prolo isn't holding. So in those difficult cases, just started treating the pubic symphysis. And then when folks would come in with groin pain that wasn't responding to traditional physical therapy, on exam, a lot of these folks had a lot of tenderness in the pubic ramus and pubic symphysis. Then I started treating a lot of pubic symphysis, pubic ramus. And then there's folks that have perineal pain. They have vaginal pain, really bad testicular pain, groin pain, pain around the rectum. And often traditional medicine would call these patients that they had pelvic floor dysfunction. And anyone with pelvic floor dysfunction just knows just how painful it can be. And then that along with myself, I had a serious pubic condition. This was about 10 weeks before I was supposed to do Ironman Canada. So during a race, my whole pelvis went out, so it was very difficult for me to finish the race. It was basically an Ironman type distance race, but it was about 10 weeks before Ironman Canada, and I barely could stand up. I couldn't have a bowel movement just because. So basically, I myself became a patient with pelvic floor dysfunction. So, and I had very little time to treat it. So I basically received prolotherapy in the pubic region, ischial tuberosities, pubic ramus, every week for 4 weeks, and had a great race at Ironman Canada. So I myself know pelvic floor dysfunction, and if your pubis isn't stable, just how painful of a condition that can be. It just can be awful. So all that together, just we see a lot of pelvic floor dysfunction, a lot of pubic problems at Caring Medical, and typically they respond great.